I'm here today with Dr. Brenda Gorman, Assistant Professor of Speech-Language Pathology at Marquette University. Brenda also serves as the Advisory Clinical Director for LinguaHealth. Brenda, today's topic is working with parents. Some parents actually participate in the therapy room, and people have discussed this online. Maybe you can talk to us a little bit about your experience with working with parents and having them actually participate in the therapy room when you're doing sessions.
If we see parents as the children's first teachers, it can be a wonderful, very effective thing. Whether or not I recommend it, of course, depends on the client's age. With younger children, it can be excellent. With older children, well, you can imagine, adolescents don't necessarily want to be in the same room with their parents at home, let alone in a therapy session. But with young children, it can work very well, but the clinician does have to evaluate how the child responds and how the parent participates as well, if it's effective, if it's really conducive to what they're trying to achieve. But there are many different options. Parents could observe the clinician and then try to implement some of those behaviors themselves. The clinician could also serve as a coach. And if the parents are working directly with their child in the session, the clinicians could coach them along the way. Some clinicians might want parents to come in just during a portion of the session, just to promote some carryover. Parents might be watching during the session and then again coming in and trying out some of the strategies themselves at the end or a portion of the session. So it really depends, but it'll be more effective if the clinician really strategizes how this is going to work. So again, it depends on age a great deal, but if you think we're with clients once a week, twice a week, and clients are with their family much longer, again, if we can empower parents to do what we're doing and empower them to facilitate their child's language development, all the better, all the more effective intervention.
Brenda, are there any cases in which you've seen having parents in the room being disruptive in the service delivery?
Absolutely. During assessment, sometimes parents, they want to answer for the children, or they'll interrupt, I know he or she knows that, come on, you know what it is, that sort of thing. So during assessments, it's often much more difficult to have them in there unless, again, it's a particular model like a transdisciplinary model where, again, the strategy is really to build in parent participation, with the clinician establishing what those roles are going to be beforehand. And an intervention as well, if the parent's often responding for the child, or if you sense that the child is talking less because the parent is in the room, you never know. Sometimes kids talk more when the parents are in the room. Sometimes they do talk less, and it provides us, it's interesting to observe because it does give us more thoughts on how to better counsel and suggestions for parent-child interaction. But again, we never know exactly what we're going to get. It is up to the clinician once he or she observes, I think this is going to work, or I would rather do it this way instead, to really work with the parents to make sure that happens. Most parents are pretty cooperative.
Well, thank you very much for sharing your insights on this topic.
My pleasure.